Hello and welcome to the SimpleMed Haematology lecture series. My name is Dr Marston Hillier and I'm the Haematology Lead. This lecture series will focus on some core topics in haematology, with the first lectures being on haematological malignancies and myelodysplastic syndromes. Today's lecture is an introduction to leukemia, and will be introducing this often complex topic. This lecture is aimed at preclinical or phase 1 medical students and allied health professionals, and so it is pitched at that level. In this short lecture, we will explore the following. We will hopefully understand that leukemia is a malignancy of white blood cells. We will recognise that there are 4 main types of leukemia, and we will try to understand the difference between an acute and a chronic leukemia. Throughout the talk, you will learn some basic blood film findings of all the leukemias and how that's potentially relevant to clinical practice. Firstly, it's helpful to understand what is leukemia. Leukemia refers to a malignant process affecting circulating blood cells. Specifically, it is of circulating white blood cells. Now, leukemias are unusual in terms of cancers in that they can affect any age. In this short video, we will explore the different kinds of leukemias. However, what we won't cover in depth is their treatment. For the most part, treatment of leukemias are split into 2 main goals. The first goal, and this is sometimes appropriate, is to do nothing and watch and wait to see how the condition develops. On the other hand, for aggressive leukemias, chemotherapy and other specialist treatments may be appropriate. We will explore these different treatment goals as we go through and talk through the different leukemias. So now, let's learn what types of leukemias exist. There are many different types of leukemia. For the purposes of an introduction to the topic, there are 4 main leukemias to focus on. We can split these 4 leukemias into the acute leukemias and the chronic leukemias. These are then further split into either a myeloid or a lymphocytic leukemia. If you don't recall what the term myeloid or lymphocyte refers to, I've created a helpful talk on this topic, and this is also available on the SimpleMed YouTube channel. Today what we're going to do is we're going to talk about each of these conditions in turn and hopefully try to understand a little bit about each condition. Let's start with acute lymphoblastic leukemia, or ALL. Acute lymphoblastic leukemia, or ALL, classically affects children. Unusually for cancers, it has an excellent but not perfect prognosis, with nearly 98% survival with modern chemotherapy techniques. Looking at blood cells under a microscope, in a patient with ALL, you may find a large number of what are called blast cells. These blast cells come from lymphocytes. Let's explore what a blast cell is and why they're so important in leukemias. Blast cells are essentially immature blood cells. They develop in the bone marrow and, in the acute leukemias, grow uncontrollably. This uncontrolled growth stops the production of normal, healthy blood cells and leads to bone marrow failure. If untreated, this bone marrow failure will result in death. One of the diagnostic criteria for any leukemia includes if more than 20% of the white blood cells in peripheral blood are blast cells, then by definition they must have some form of leukemia. Under a microscope, these blood cells are slightly bigger than you would expect and have a very large, dense nucleus of a large amount of darkly staining genetic material. As they are blast cells and very mature, they do not function as normal white blood cells. The key differentiating point here is that the large number of blast cells stops the bone marrow from working. This is the key differentiating factor between an acute and a chronic leukemia. Let's talk about the other acute leukemia. We've discussed ALL, which typically affects children. In contrast, AML, or acute myeloid leukemia, often affects adults. It is derived from cells of the myeloid lineage. It is a very aggressive form of blood cancer. If left untreated, the time from diagnosis to death is often weeks due to bone marrow failure. With modern chemotherapy, it is very treatable. Under a microscope, you would expect to see a large number of blast cells with a simultaneous pancytopenia, where the levels of hemoglobin, platelets, and normal white blood cells are very low. Haematologists often worry about one specific subtype of AML. This is a condition called APML, or acute promyelocytic leukemia, and we're going to talk about that now. APML is rare. It is a type of acute myeloid leukemia caused by a chromosomal translocation between chromosomes 15 and 17. This mutation causes a large growth of blast cells that are stuck in their development. Death occurs within days, often because of uncontrolled bleeding, usually intracranially. It is important to recognize APML specifically because there is a safe, non-toxic treatment which allows these immature blast cells to become normal, healthy white blood cells. This is a life-saving treatment and is called all-trans retinoic acid. Patients would still require chemotherapy, but their risk of dying is massively decreased. And it is important to start this treatment within hours of recognizing the disease. Now, we've spoken about the acute leukemias and one specific subtype of AML. These are all characterized by the presence of blast cells causing bone marrow failure. In contrast, the chronic leukemias are characterized by white blood cells that are more mature but still haven't yet fully matured. They are still a form of blood cancer, but as the cells are more mature, they do have some function that is expected of normal cells, but just do not work as efficiently. The condition is slower and less aggressive, and is often picked up incidentally as an unexpected finding on routine blood tests. Often the treatment is watching and waiting until the condition progresses. At any time, the chronic leukemias can turn into their acute counterpart. Under a microscope, we would see a large number of mature cells with maybe one or two blasts, but mature cells are the predominant factor. CML, or chronic myeloid leukemia, is a chronic leukemia affecting the myeloid cell lineage. Consequently, CLL is a chronic malignant process of the lymphocytic lineage. The hallmarks of CLL would be a very high white cell count on a blood test of specifically mature lymphocytes. CLL is often associated with a hemolytic anemia. Patients also get a functional immunosuppression due to the loss of lymphocyte function and are at greater risk of infection. This again is often an incidental finding on blood tests, and treatment is often delayed until there's clear evidence that it's causing problems or the condition is progressing. In this short talk, we have learnt that leukemia is a malignancy of white blood cells. We've recognised that there are 4 main types of leukemia, and we've outlined key facts about every single type. We've understood that the difference between an acute and chronic leukemia is the presence of bone marrow failure, and we've also discussed some of the basic blood film findings of the leukemias, specifically talking about the importance of blast cells in their diagnosis. That is the end of the lecture. Be sure to check out simplemed.co.uk for hundreds of free articles, thousands of free questions, and any support with questions that you might need. Thank you for listening, and goodbye.